Hi, I'm Dr. Kelly Starrett with the Ready State. Let's start with a simple premise. H-wave is better than icing. Now that seems like, are these even in the same category? But let's keep in mind that when we're talking about management of pain, or we're trying to say, hey, how do I facilitate the body doing what it naturally does? If we compare the two, they're certainly not on equal footing. When we're icing, what our intention right away is to give someone some on-demand pain relief. Sometimes it's placebo, certainly with little kids. But the idea here is, well, if I can make this really cold and numb, I won't experience my discomfort. And certainly we can understand for most people, they're saying, hey, I've got some swelling here. If I could stop the process that's causing the swelling, perhaps that would also give me some relief. The problem with swelling is that it's a normal response to our body, and it's a normal healing response. And so the question is, do I want to actually do anything to impede my body's natural healing ability? And more importantly, do I actually want to shut down my body's healing response? And the answer unequivocally is that may be less effective. And the reason is, when you get something really cold temporarily, it may feel good for that moment, but as soon as you take that off, the rest of the processes are still going on, which means we're still going to start an inflammatory response. It's going to be delayed and attenuated, and we haven't really done anything to remove that swelling from the tissue. So that's sort of a problem. It leads us back to square one, even though we got some on-demand pain relief. And don't get me wrong, there's certainly a time for icing. Specifically, we think placebo for little kids who've been stung by bees. On the other hand, what we want to always adopt is if icing isn't going to be what we recommend, then we can sort of take a position that active recovery is always best. What that means is, if I can get a non-fatiguing muscle contraction in a system that's got some pain, a lot of things can happen. Number one, I can be decongesting or moving that swelling along up the sewage system of the body. And remember, the sewage system of the human body is bootstrapped into the muscular system. So you can see that if I'm passive and I ice something, I'm not actually engaging any muscle contraction. And believe it or not, it's that muscle contraction that's going to drain all of that swelling and congestion. So I have passivity and potentially rate limiting my healing, or I have this idea of, hey, if I can get some non-fatiguing muscle contraction, I can move that swelling along. What ends up happening is when we're able to better manage congestion in a tissue, right? A knee is swollen, I've got a little hot spot or some swelling in an elbow. The idea here is that, number one, that swelling can often be the generator of sensitization. That tissues that are swollen and congested are more likely to be sensitized or perceived by the brain as a threat. So when we get ahead of that, we actually see that we do much better in terms of pain management. Number two is that when we compare icing to movement, one of the things that happens with the icing is that we're not actually getting blood flow. We're actually going to decrease blood flow, right? As those tissues become sort of cold, they're going to vasoconstrict. And with the technology of something like H-wave, one of the things that happens is we actually see increased blood flow to the area. So not only are we taking the garbage out, which is crucial, but we're also going to bring the groceries back in at an enhanced rate compared to anything that sort of rhymes with passivity or an ice bag on the air. The other thing is that when I'm moving, I engage in something called the pain gate theory. And this model is one of the ways that we have to appreciate that the brain sort of understands a painful response. And that movement and pain pathways in the brain are in the same pathways. So just like if you banged your hand and you moved it, you're not really hearing that pain signal because it's being overridden by the movement signal. So if I can engage with my H-wave, I'm going to get some non-fatiguing muscle contraction, but my brain doesn't know that I'm not moving the limb. What my brain is perceiving is that there's movement happening in the tissues. And as a result, what will end up happening is that the brain will not be able to hear that pain signal as loudly. So not only do we start to see better blood flow, decreased congestion, but we're also able to override that pain signal with just simple movement. What's remarkable about this too is that when we have surgery or trauma, we see that when we start to just gently pull on the tissues through normal muscle contraction, we see better scar formation. Instead of having collagen that's highly disorganized in a position or a surgery where I'm kind of protecting something, by go ahead and getting some early movement, we're able to basically tap into the fact that these tissues need gentle forces to remind them how to heal. This idea of mechanotransduction is that these tissues actually need loading if we're going to see them become more normal in that healing process. So quickly you can see that we compare movement, non-fatiguing muscle contraction, to icing, and there's really not a fair comparison. Add in the fact that we can actually run this technology on a pumping sort of low frequency model. We can do that for almost 24 hours a day comfortably. One of the problems with icing is that we have to be really careful that we don't get the tissues so cold that we actually engage in freezer burn or ice burn. And that's a real consideration anytime we're using ice. We have to really make sure that the tissues have a chance to warm back up. We never have a safety problem with the movement. We also find that people can't ice when they need it in the middle of the night, in bed, and one of the things that happens is that we can actually run this all day long while people are, at work, while you're on the couch, while you're making dinner, while you're sleeping. It's pretty remarkable. In short, when we try to compare the two technologies, right, icing versus sort of tapping into the body's ability to decongest and heal, the comparison is really not even a good one. That we basically are saying, hey, I have nothing I can do, but I need a placebo effect to try to give me some on-demand pain relief. Or I can work with H-wave, which exceeds and actually works with the body to facilitate a more complete healing response, number one, and number two, much better on-demand pain relief. And we haven't even mentioned the fact that the H-wave technology has a high frequency setting which allows us to go after a painful target. We're just talking about, facilitating natural tissue healing. So if you're comparing the two, understand that we have basically this going to space with technology that is remarkable and adapted and used by every professional organization on the planet and more professional teams. Or we have this idea, hey, I've got something cold in a bag, and I'll put this peas on there, non-specific, and I hope it gets better. Obviously, this is our better choice.